So we're going to add one additional very simple exercise, but it's an important exercise. It's an exercise which crosses many different venues of practice: outpatient orthopedics, home care, acute care. We now have a patient who, again, has weak proximal hip joint muscles, perhaps some load-bearing intolerance where their cartilage and subchondral bone doesn't tolerate standing well, or perhaps there's a balance impairment where you don't feel comfortable in having the patient train these muscles in a standing position. Okay. In addition, we'll be going into the hook-lying position, so this is a patient who feels okay and is able to breathe well when they're lying more flat on their back. So let's take a look at this. This exercise is sometimes known as the butterfly exercise, and it allows for isotonic training of the proximal hip abductor and external rotator musculature. Be creative with what color band you use. Use bilateral isotonic contractions. Use unilateral isotonic contractions for the involved hip. And incorporate multiple angle isometric training for the involved hip, demonstrating a weakness impairment of the proximal hip abductor and external rotator musculature. In this same hook-lying position, you can also incorporate isometric strength building of the hip extensors and continue with the butterfly exercise for training of the abductor external rotator musculature.